Hi guys! So welcome to our live chat. Tune in with Randev. Let's unzip a topic.
I'm Ranjini.
And I'm Devapriya. So today is going to be our episode number 12.
Yes, that's right.
Ranjini, you're looking gorgeous in that sari.
Thank you,
Yeah,
Priya.
any occasion?
Yes, wedding preparing. So, how was
Alright,
your
that's
holiday, by
awesome.
the way?
Yes, my holiday was fantastic. I really had a good time. And yeah, it's kind of, relaxing trip after very long, after all this pandemic chaos and all that.
Mm-hmm.
So this was a superb holiday.
Mm-hmm.
And yes, I think by next week we will be together. So for the viewers, this time we again in a separate place, but that's okay. However, the show must go on. So Ranjini, so as usual this week
Yeah.
also I'm going to share the screen on your
Thank you.
behalf.
Thank you.
So let's go for
All right.
it.
Let's do that.
Hold on,
Yeah.
huh? Yep, hold on. Okay. Ta-da!
Okay. All right. So this is our logo as usual. So, yep. This program is powered by MindApps, Malaysia's best online learning platform. And for this week's episode, shall we reveal the panelists and topic?
Yes, sure. So this week's episode is going to be Time Out with Eczema Doc. So this is our episode number 12. So who is our panelist, Ranjini?
That's right. Our panelist is none other than Dr. Aylwin Vincent Vasudevan. And I would like to mention one of his phrase that we find it very catchy and would like to highlight is experiencing eczema as a patient made me a better doctor. That's really a powerful statement from him, and we really would like to hear from him. And of course, we are really honored to have him on board. So let's invite him on board, Priya.
Yes, sure. Without any delay, doctor is ready. So here we go.
Hi everyone.
Hi, doctor.
Hi, Dr. Alvin.
Hi.
How are you doing?
Good. I'm doing. How are you guys doing?
We are
We are doing
fantastic.
awesome.
I'm so sorry.
Yes.
How are you ladies doing? I'm so sorry.
Okay.
We are excellent.
Yes.
All right.
Thank you
We
so
are
much
excellent.
for joining our show, Tune In with Ran and Dave. We are really humbled to have you on board with us and
It's my
sharing on
pleasure.
a
Thank
very,
you.
very interesting topic on eczema. So, doctor, the stream is good?
Yep.
All right.
I can hear you. Yeah.
All good.
So I think most of the viewers know Dr. Aylwin, and maybe some of you all don't know. We really would like to bring him here, and from all the knowledges that he's going to share, I'm sure at the end of the day we're going to gain so much of knowledge about eczema and more things throughout this session. So we are going to straight to the program, and the first question is going to be, Doctor. We have highlighted as the topic says it's about time out with eczema doc. So perhaps an introduction about what is eczema, and is there any classification or general description that you would like to start with, doctor?
All right. So I think many Malaysians might have heard the term eczema, but not many people know that actually there are many types of eczema. So eczema is actually a group of inflammatory skin disorders, which is chronic, and it can go and come back. That's what we call it as relapsing. So many patients have, they have probably one episode of mild itchiness, and then they go and see the general practitioner. They get some creams and some medications, and then it goes off. But some of them, what happens is over the years, it starts to come back more often, and it gets worse over time. And not only that, under our CPG, we have a CPG, a clinical practice guideline for eczema. And from that, we have actually known that there are 7 types of eczema that we know of up to now. But I'm not sure, with new research, we might get more definitions. But up to now, we have 7 types.
Okay.
7. That's
Yes.
a lot.
Yep.
Yeah, I mean, would you like to name those?
Yeah, right. So the most common one that I see, and most of my patients and even myself, was probably atopic dermatitis. That's a very common type of eczema. But there are also other types like seborrheic dermatitis, which happens more on the scalp area. nummular eczema, which is coin-shaped lesions. All right, it happens in the legs, the hands, and so forth. We also have neurodermatitis, which basically, because of constant itching and scratching, it basically causes injury to the pain nerve ending. So eczema patients not only they have itchiness, they can even tell you that they have severe pain, just like you're having a joint pain, those kind of pain that you can feel under the skin. So it can be quite excruciating. And there are also other things like Stacey's dermatitis. So patients of an older age group, things like when they have things like varicose veins, they have a risk of getting Stacey's dermatitis, which causes the swelling of the leg. So it's pretty much something that most patients really struggle with, but they don't really openly talk about eczema because the issue with eczema is that because it's not life-threatening, so we might look at it lightly, but I can tell you that it's life-changing. So it's pretty it's pretty difficult for the patient. So I hope that today's talk can actually I want to be a spokesperson, not just as a doctor, but also for eczema patients who are struggling, not just in Malaysia, but around the world.
That's awesome.
Yes.
Yes. So it
there's-
is not a life-threatening disease, but yes, as doctor said, it can change your life. Yes. And yes, according to what he says, I mean, it's not just like a infection on the skin, but it's more than that. And what the patient going through is even more. Sometimes it's tend to get worse. And I think this show today is going to be an eye opener for most of our viewers. So all the viewers, if you guys have anyone, maybe in your family, in your friends circle, who are suffering from eczema, do share this to them because they might get a lot of benefit from what Dr. Aylwin is about to share furthermore. So, Ranjini, anything more to add? Or shall we go to the second question?
Let's move on to the second question.
Yes. All right. Doctor, as you said, there are 7 types of eczemas. And can you please elaborate on what actually causes eczema? I mean, actually, what's the trigger point? What causes eczema to happen to someone?
So I think it's a good question. So in fact, this has been a huge debate even among practitioners because some of us have this formula, some of us have that formula. But I think understanding from how I approach it, that's how I've been able to help a lot of patients, including myself actually. So majority of us, what we believe is it's actually a genetic inheritance. So we have this thing called the filaggrin gene, which is very important for the skin barrier. As you all know that, I'm not sure whether you know, but let me ask you a question. What do you think is the biggest organ that we have in the body? What do you think, Dan?
Skin.
Okay, I think it's obvious, right? Right, but that's a good answer because when I got this question when I was a student, we were thinking like, we were thinking like a cardiologist, or probably the heart or your lungs or, things like that. But then, skin is the biggest organ. In fact, if you realize your skin from your head towards the toe is just one, it's just continuous. It's not just like the skin on the face is separate. No, it's all continuous. So we have to understand that skin actually works as a protective mechanism that God has created for our body. So many of us actually don't really take much, effort in other than cosmetic purpose, but actually skin has a lot of health benefits and protective benefits. So once the filaggrin gene, if there's a mutation in the filaggrin gene, what happens is the skin barrier is compromised. So when the skin barrier is compromised, issue is water loss can happen from the skin. That's why most eczema patients have dry skin, for one example. And then it also opens up a huge space for pathogens to come in, allergens to come in and cause reactions. And that's why patients really, really struggle. So these are the components of eczema which people really struggle with on a daily basis.
Okay.
I mean, apart from that, any other, is it any genetic reasons? Or?
Yep. So what I was saying is that it actually could be a mutation in the filaggrin gene. So that's why some of us have this issue. So let's say if my grandma probably had a history of not necessarily eczema. It could be even asthma, or it could even be sinusitis, which were not diagnosed. Especially those days, it might have not been diagnosed because of probably lack of access to healthcare. But now I think it's pretty much easily diagnosed. You can just see your GP near your house and he can tell you, hey, you might be having asthma and stuff like that. But all of this actually is related. So what I found out is that if we see eczema from the point of this term called histamine intolerance, the whole game changes. I'm talking about the whole management, the whole way we look at eczema. And this is where I might differ from other practitioners, and this is what I do with my patients. So I've now patients from Johor to Penang to Sabah and Sarawak, and most of them, I'm probably the last guy that they meet. So being an eczema patient myself, I can really understand how they feel, the psychological aspect, and so forth. And then I tell them that if we can identify possible root causes of eczema from the point of histamine intolerance, we can actually solve a lot of problems actually. So I hope that you ask me the next question, what is histamine intolerance? If I can
I
answer that
wanted,
better.
yes. I know it's
Can
something
read the
about
mind.
a
It's a
reaction.
anti-allergens, something like that.
Okay. I'm not
Right,
sure from.
right. So actually histamine is a very underrated enzyme. It's actually an enzyme. Now, enzyme is basically something that we need. Without enzymes, our body cannot function, our heart cannot function, our brains cannot function. So even our digestion, what you eat, without enzymes, you can't break down, you can't process it, and so forth. So enzymes
Yes.
are an integral part of our lives, and many people struggle with just simple enzyme deficiency. That thousands of enzyme deficiencies that many babies are born with this thing called inborn errors of metabolism. So there's a lot of issues with enzymes. So histamine is an enzyme, but we don't really put much of focus on it actually. As I said, because it's not life-threatening, probably we don't put much focus. But let me just explain here. So histamine intolerance happens when the histamine levels are very high. So to make you understand this in a simple manner, if the histamine levels are high in your sinuses, that means in your sinus system, you are prone for early morning sneezing, just a little exposure to dust and you start sneezing. Okay, I'm quite sure, when you go to school, you might have one or two friends who kept, blowing their nose in class, or probably in college, they get triggered very easily. And what they do is they just pop in some antihistamines, and they, without knowing that what's actually causing the histamine release in the sinuses. Same thing when the histamine release is high in the lungs, it causes bronchoconstriction. So patients have shortness of breath. So there were cases where patients go for a buffet. I'm not sure whether you've heard this, but I've actually encountered a case where he went for a buffet, had an asthma attack. Now, as we all know, probably asthma attack is probably caused by some virus or some sort of pathogen, some bacteria.
Yes.
But actually, we have probably missed out another factor of histamine intolerance. So when this patient went for a buffet, he ate a lot of prawns, and prawns is high in histamine. And when there's a lot of histamine accumulation in the lungs, it causes bronchoconstriction, and hence, when you see the doctor, he puts you on a nebulizer. Same thing when the histamine contents are high on the skin, it causes skin dryness and itchiness. So the issue is not being eczema or asthma or sinusitis, it's actually histamine. That's the main culprit. But at the same time, for the benefit of histamine lovers, histamine is not an enemy to us. It's just that everything has to be in balance. When there's oversupply of a certain thing is not good. I think the saying goes that too much of a good thing is actually bad. So when the histamine levels are high, it causes this manifestation of diseases. So if you ask me, eczema is not just a skin disorder, it's just a manifestation of a skin disorder which has some issues happening from within. So if we can actually go down to the root cause, find out what's actually triggering that histamine, the histamine rise, we can actually solve many patients. I have a number of patients that after going through a proper history taking and proper examination, we get to find out their possible root causes. And when we identify, manage those root causes, patients get way better. They get good sleep. They're back to work. And I'm not sure whether you've heard about my story, but I was stuck in my home for about 1 year. So now I'm back. So that's actually by identifying root causes. So I think if we can do that, patients can actually get a good benefit from that.
Awesome.
Okay, so it is not just about treating the skin, but to
Yep.
find out what actually caused the eczema and to find the root cause and cure it there. So that was fantastic, Doctor. I mean, earlier of this question, you have asked about the genetic thing, right? So is there probably from your experience, what are the percentage, like if let's say my grandmother had eczema, and what are the percentage of possibilities that me or my generation would get it? Is there something, the calculation like that, or it is not like that?
Yeah, it's a good question, but I don't have an accurate answer for that. But we
Okay.
do deem it as high risk. So, for example, one of the questions that I ask my patients is, do your parents or your grandparents have any history of either asthma, sinusitis, or eczema, or even gastritis? You'll be surprised.
Mm-hmm.
I've even had a patient who used to come into the clinic every single month for gastritis symptoms, bloating, our Indians to say kate, they have a lot of
Yes,
wind in the
yes.
abdomen and so forth. So they have bloating. So when
Uh-huh.
in our medical books, there's no such thing as wind. But actually, what they're trying to say is, but that feel that is bloated and so much of wind, well, that is
Yeah.
also because of histamine overload actually. And you'll be surprised. I had one patient. He used to come in every single month. We used to give him so much of medications, every month. And you have to understand that medications on a long run definitely has some sort of side effects. So we need to know when, and I'm not against medication. Medications are important for acute episodes, but prolonging medications where we need to also find out what are the other side effects and whether it's counter, interacting. I think Deva Priya, I think you're a pharmacist, so drug to drug interactions can
Yes,
also happen, and
yes,
many of them
yes.
have
Drug to
chronic
food. Mm-hmm.
issues. Right, and drug eruptions and
Mm.
so forth. So what we found out is that I had this patient. I just told, okay, buddy, just go on a low histamine diet and just focus on low histamine diet, meaning we still maintain your carbs, we still maintain your
Mm-hmm.
fats, we still maintain your proteins, your macronutrients, but in a different proportion. And
Oh,
guess what?
that's
He doesn't come back to the clinic anymore. And he doesn't have symptoms anymore just by changing the diet. And these guys have been struggling for 5 years. So again, it's not just
okay.
about the word gastritis or eczema. It's actually going down to the basics of histamine. So ranitidine, for example, is an antihistamine, and it's what we
Mm-hmm.
used to give before we had a lot of issues with that current drug. But that is also one of the drugs that we give either oral or intravenous previously. So it's antihistamine. So it goes back to the the root issue of histamine intolerance actually.
Yes, yes.
Mhm.
Okay,
Doc-
thank you for the elaboration, Doctor. Mm.
yeah, just one more. Like, can a person out of sudden, at like any specific age, like let's say they are past 20 or 30, and out of sudden they get eczema?
Very good question. So, in fact, I get this question a lot. So, many patients, when they come and see me and they have probably adult eczema, we call it adult eczema, and then they ask me,
Mm-hmm.
Doctor, I don't think it's eczema because, when I was a child, I never had it.
Mm.
Let me tell you that I never had eczema when I was a child. And
Mm.
my level of eczema
Mm-hmm.
was so severe that I had to be started on immunosuppressants. Some of these drugs are used as chemotherapy drugs also. So
Mm.
these are very drugs that you need to really monitor blood counts and so forth because a lot of side effects also. So adult eczema is very possible. Reason being is because of the food that we have been taking all these years. Many things like processed food. Many of us
Mm.
don't really focus on diet. So we're very busy with work, and everyone's so stressed, running up and down. That's the reason why I moved to Nila. It's very relaxed. I can literally park my car in the middle of the road, no issues, nobody's calling me. But in
No
Puchong,
one
in
survived.
Damansara,
Don't
right.
expect
So
that. Yeah,
so
you
but
can
but
pass.
the life, especially in urban cities, everyone is running up and down and they're rushing, and we don't
Yes.
give time for food, and nobody cooks and brings their food to work. But I'll be frank, I cook, I bring my food to work in my clinic. In fact, my wife, if she's free, she helps me also cook. So what do you call, again, to all Indian husbands, please don't push your wives to cook. I think you can also cook. If I can cook, I'm very sure you can, because I only
That's a
used
good
to,
message.
yeah. So I used to only cook telur goreng, and
Thank
that's the only
you.
thing I could do it. And now because of my
Okay.
eczema, and I've learned it up. So I really there's this excuse of not having time. Well, you better have time because time is reducing. You'll have other issues. So processed food, eat things like dairy products. You'll be surprised, milk can actually trigger a long-term effect on eczema actually.
Okay.
If so, in other words, what you're saying, just to sum up, is that an adult, if they get eczema at the later age, like past 20 or 30, it could be one of the reason could be because of prolonged consumption of processed food.
Yep, one of the factors, and also other things like stress. We also believe in genetic inheritance. For example, I've had a history of constant rhinitis, so I had a septal deviation before this. So I did a surgery in India when I was studying there, and so I had sinusitis actually. But the family of we call this atopy. So sinusitis, asthma, and also eczema, they call it the atopic march. So I had all three actually, but it manifested at different times. And what I believe is, like what you mentioned, Ranjini, food basically played a huge role because of years of I don't want to mention brands because I don't want to bring down any brand, but fast food, things like that, and like deli
Yes.
meats, sausages, burgers. These are all really bad processed food. And if you go to a local Malaysian fridge, if I probably I should come to your house and check out your fridge. I'm quite sure 70 to 80% of the food products will be processed. I mean, rarely we see vegetables, fish, chicken. Even chicken might be processed chicken, like chicken nuggets, chicken burger. But if you go to a local Italian house, now Italy has one of the, I would say, among all the countries, the average lifespan of the Italian is one of the longest in the world. And most of them, they eat yummy food. They eat gluten and things that I don't really advocate, but they eat fresh food. They're talking about truly fresh from the farm, and they consume it. So I think Malaysians have to really focus, not to be so swayed away by American culture, so much of processed food, but actually going back to our ancestral roots, Indian food, Chinese food, Malay food, which are really, really amazing. You'll be surprised. Indian food has so much of amazing spices like turmeric, which is part of my treatment. It's part of my treatment protocol
Oh,
in
I
my diet.
see.
Plays a huge role. Even jiragam, jintan putih, and all these things play
Yep.
a huge role.
Yep.
Coriander. So I'm actually what do you call a master of spices now, because I never knew about the spices before this. Because I used to always push it away, because you know what, all my nails will become yellow. When you cook with turmeric,
Yes.
your hair. So but now it doesn't matter because turmeric is really good. It's a very potent anti-inflammatory agent, and it's quite amazing actually what we can find in the spices.
Yes, I totally agree. I love spices. But doctor, just another one question on
Spices
the
of India. Yes.
generation. So, how many level of if it is caused by generation? I mean, not generation, genetic. How many level of generation are we referring to? Is it like from your grandmom, or like 2 levels, or is there any specific level that we should check? Track back.
Basically, for my patients, when I do my history taking, I just go back just up to the grandparents, because most of them who come to me, they have positive family history. So either the parents or grandma, a great grandmother and great grandfather might be an issue in Malaysia, because some of us have history of roots from different countries, so we might not know it. So the only thing that history taking, which will be the most practical, will be just to find out maximum up to the grandparents actually. So second generation, to answer your question.
All right.
That's adequate, I guess. So what from?
So shall I? I think we move on first, then.
Sure. Go ahead,
Okay.
Ranjini.
So never mind. We are gonna let's move on to next question. Otherwise, we will not. This show will go on and on. So that's really a good sharing. We learned a lot from this one. But first 2 questions itself. So for the viewers, if you have any questions which you would like to direct to Dr. Aylwin, you can always type your questions in the comment box, and we will direct it to him at the end of the show. So moving on to the next question, Doctor. You're a medical doctor, but we have this question: what triggered you to give particular interest in treating eczema?
Right. So actually, I've been in practice for touching 12 years. my maths is correct. So I started in 2008. I did my housemanship in Malacca, and then 2011, a friend of mine, I think you all know Dr. Niven. So he came and talked to me about getting myself involved in entrepreneurship. So I thought, it's a good thing. So what I did was in 2012, I decided to actually go full time to entrepreneurship. So I took a short time off from the medical world. I was still practicing, but was probably just doing locums and so forth. But as I kept practicing, doing business, so I was juggling between the medical world and also business. And what I've realized is that because of my very poor sleeping habits and me running up and down around Malaysia and so forth, to do talks, and I love doing talks. So please stop me if I'm talking too much, but I just love to explain things. So it's just my passion. So the issue is that when I've been struggling with eczema since 2008. So at that time I was I'm not going to inform my age. I was in my
Okay, you look young, however.
yeah. Thank you so much. We can repeat that again, but yeah.
You
So
look young, yeah.
so I was actually in my mid-20s when I first got my first eczema condition, which on my hands. It's called contact dermatitis. I just imagine I'm a doctor and I'm allergic to gloves, so I had a huge problem in my workplace. So
Yeah.
I was struggling with eczema, and then I got my first asthma attack while being a medical officer, while I was doing my on calls. I was so stressed up. I was having a lot of cases because I was in a district hospital. So we see all disciplines, from pediatrics to orthopedics to
Yep.
heart attacks and so forth. And what happened was as time went on, the eczema started to get worse. And 2017, it went to its peak where it was really disturbing my business, so I couldn't even go out of my house because once I start scratching, and for those who don't know about eczema, it's not just an itchy disease, because many people think it's just itchiness is a very underrated symptom. Pain is a very a symptom that we give a lot of emphasis, but itchiness is a very underrated symptom. So I hope this gives awareness. When you see someone struggling with chronic itchiness, please don't look lightly. It could be an issue. And because of that, I had to stop my business, stop my medical practice, and just sit in my bed because I couldn't move. I was scratching. Just imagine, I didn't use my fan or aircon for 1 year because it would flare up. As soon as I get exposed to it, it would flare up. So each time when I scratch, it went to extent that I didn't have any skin to scratch because it was wounds all over. So I was literally bleeding every day. I couldn't eat with my hands because my hands were filled with wounds. So just for you to know, I was already in my mid-30s by then, and my mother and my ex-girlfriend, which is my wife now, she used to come and visit me and feed me almost every
So
2 days.
sweet.
So it was
Sweet.
really bad, and my legs swelled up to extent it was truly bad. So because of that, I was just struggling at that moment. I was just thinking, because I tried so many things. Trust me, as eczema patients would lament with me. They've tried almost every thing. So I went for a lot of treatments, both Western, the basic, hospital setting treatments. I've also gone for traditional, both Indian and Chinese. I stayed in Ayurvedic center for about a month, and I went through the treatment, all massages and diet modifications, and I tried so many things, and nothing worked. So it was very, very frustrating, and at that moment I had a lot of other things that probably I think you'll be asking me questions on that later. But coming back to your, just to make sure I don't go out of topic based on the question. So could you emphasize the question again so I don't go out of topic?
Okay. Sure. What actually triggered you to give particular interest to eczema rather than anything else?
So at that moment, because it happened to myself, right? So I was just wishing how it would be so nice if a doctor could be open in integrating both Western and also traditional medication together. And it would be so nice that if you could just, because I couldn't move out from my bed, so I was just thinking how nice it would be if I could just do a video call. And I found out there was one person it's a very renowned guy he's in the UK. His name is Dr. Richard Aaron. So I wanted to get in touch with him, but apparently he's so busy that he has patients from all around the world, looking for him. and I got a
Mhm.
chance to meet his apprentice. Okay, his apprentice is a dermatologist. Just for a 15-minute consultation, I were to spend 1,000 ringgit, and that's without medication. Just a 15-minute consultation, and it doesn't matter whether my streaming is okay. I might probably get 5 minutes worth of consultation. So I was thinking at the moment at my bed, how nice it would be if a doctor could just do a video call to me, guide me step by step, so I don't have to do the research. I was thinking, what if that could happen? And now that is a reality that I'm doing with all my patients. And for my patients, for my eczema patients, up to now, I've not charged any consultation charges for any of my patients, because I promised myself that if I could just do it, FOC for eczema patients, this would be my passion. And now I'm actually living my life doing this, and it gives me so much satisfaction seeing my patients getting better, actually.
Yep. We will speak about that more in depth later, and so that's really nice. So I would say that, Doctor, you from the sharing you have just made, that you actually encountered you having eczema at adult, when you're already as a doctor and so on. So I would, but is it because of genetic, or because of the lifestyle, or how would you?
It's actually multifactorial. So one is, I do believe it's genetic, because my grandma had, on my dad's side, she had asthma. So definitely there is some sort of genetic inheritance. And my mother had late onset asthma. She had the
Mhm.
first symptoms of bronchospasm at the age of 50. So I think people should take note that just because they don't have any childhood history doesn't mean that they won't get it. So it's a
Mhm,
combination of genetic inheritance, stress, I
mhm,
think lack of proper sleep,
mhm.
emotional issues. So it's actually very multifactorial, and I think most importantly, my diet. Very bad. I had very bad diet habits, actually.
Okay. All right.
Yes.
Okay.
Usually, that's very usual among doctors and housemen most of the time, because we don't have enough time to take our lunch. We just grab whatever we got, and yeah, that's
Yeah.
how life goes,
Predictable will
especially in
become
medical
worse.
line.
Yeah.
Yeah,
So
that's right. That's right.
we are getting overwhelming feedback. I mean, comments from our viewers.
Yes,
So I guess that's really nice to hear from them. So we will display it from time to time. So I
Okay.
guess yeah, we can move on to next. But before that, we're going to make a sharing.
yes,
Yes.
yes, Ranjini.
So share my screen before we move to the next question. I believe it's good, Priya.
Yep,
Okay,
I'm adding to
so
the stream.
all right, so I'm going to
Oh,
play this.
who's that handsome guy? Wow.
Yeah.
Line helps patients know me as eczema doc. I'm actually the founder of this very page. The main purpose of this page is basically to give vital information about eczema to help eczema patients nationwide. Being an eczema patient myself, I struggled. It was so bad that my eczema spread throughout my body to an extent that my legs were swollen, I couldn't move, and I had to stop work for a very long duration for a year. But by God's grace, after doing massive amount of researches, reading journals, and engaging with other practitioners around the world, I found out that there are other options for treatments and possible root causes of eczema. And if we can handle those root causes, one can come out of the eczema. Eczema is not curable up to now, but you get eczema free. So feel free to inbox me and check out all the videos here. And this can be also a big benefit for you. And if you feel it's very beneficial for you, share this to your Facebook page or profile to increase awareness for eczema. God bless you. I'll see you soon.
So
That's a
I
cute
definitely will
explanation.
go specifically on that
Hi
page.
everyone. My name is Dr. Aylwin.
Sorry, am I?
Live
Just a moment.
and
Yes,
Sorry. Okay.
yep.
So we'll definitely go more in detail about eczema doc and what you're doing on that. But before that, we have a question. So Priya, yeah.
Yes. So the question sounds like this. As an eczema patient, what are the challenges you face from various aspects of life? I mean, you said it's a 1 year journey that you struggled and become eczema free at last. And I believe you have gone through a lot. So would you just mind to share that among with us and for the viewers as well?
Yep.
Right. So actually, just to clarify, I struggled with eczema since 2009, actually. So it's been a 11-year journey actually. So, but the last, I think the 1 year that you mentioned was where my eczema reached to the peak level. So that was the 1 year where I was actually stuck in my home. So there are a lot of actually issues. One is socio-economic issues. So I couldn't work. So my finances tremendously dropped. Adding to that, I had a lot of loans to pay. So I was financially out, so that really stressed me up even further. Second is I think the disease took a toll on me in the sense that I didn't know what to do. I would cry every day. Some of my colleagues don't believe that I cried. They never seen me cry, but yeah, I cried every day. My mom would be a good witness, and I saw it even taking a toll on my parents, family members who have eczema. Either the son or the brother. It's quite a struggle for them to see, their own loved ones, suffering and not knowing what to do because it comes and goes, and it goes to the extent that nothing works at one level.
Yeah.
And adding to that, I was also about to decide to break up with my then girlfriend, which is now my wife, because I didn't see myself coming out of it, and she's so gorgeous, she's so pretty, and at that time it was not good to look at.
Yes, she is.
Yeah, and I didn't want her to struggle, and I used to push her away because unknowingly, I did not know, but I was trying to push her when she was really hurt. And I still remember, and this is something I probably want to share, something personal. There was once that because I was stuck on my bed, and for you to know how bad it was, even for me to go to my bathroom, I have an attached bathroom to my room in my parents' home, so I had to move into my. Just imagine a 30-year-old doctor moving into his parents' home because he can't afford to pay rent where he used to stay. It was that bad, huh? It was that bad. I had rate notices and all that. So even for me to go to the bathroom was a struggle. It would take me 30 minutes for me to go from my bed to the bathroom because I would, wrap myself with wet towels because as soon as I open my towel, I will start having intense itching. So I still remember sleep was a huge struggle. I couldn't sleep for 8 months. So while everyone's sleeping and snoring and dreaming and so forth, I couldn't even dream. I've never got a dream for the 8 months, actually, the 8 months to 10 months. I didn't have a single dream. At 3 a.m., I'll be scratching, and my body is so tired, but I just can't fall asleep. So I still remember at, I think it was lunchtime, I was sitting up on my bed. I don't come out from my room much, actually, because, I don't want to be exposed to wind and I don't want to talk to people. So I isolated myself. I went into depression. And at that moment, I remember my wife came in. She was then my girlfriend. So she came into my room, and I closed my eyes. So she thought I was sleeping, but I was just lying down, but in a sitting position. So I was not asleep. I just closed my eyes, just resting. And my wife actually took my hand, took my shoulder. She lifted my shoulder and she came here so that I would hug her passively. It means she would induce the hug, and then I realized, oh my goodness, I've not even hugged my girlfriend for many months. And then I realized, what I mean, that was it, lah. I mean, that was the peak of everything, and I realized, oh my goodness, what's happening? And that was when I decided, probably the only way to solve this is to commit suicide. So I even had suicidal intentions. So these things are real. So I want to openly tell about this. If you have depression or even anxiety, or feel like giving up, or even suicidal intentions in regards to eczema, please take note that even a doctor like me, I'm a very highly motivated guy. If you know me, even a person like me, it can break a person, it can break anyone. So I just want to encourage others that there is a way out of this. You don't have to struggle and have this thinking that you need to struggle with eczema every day. You can come out of it, but it might take time. It might take time for the your practitioner, or if you're seeing me or any practitioner, to find out the root cause. But don't give up, because I thought it will never work for me, because I read so many stories of this guy getting better, that guy getting better, but the question was, when am I getting better? But at last I got better. So every time I see a patient, this comes to my mind. I envision a future where he or she is eczema free. This is the normal routine I have for all patients. I tell patients, I will not give up until you give up. So this is what I do in my practice currently now.
I just want to ask something, doctor.
Yes, please, Priya. They're gonna have so many
So
questions.
from all that struggle that you have went through, and I'm sure there would be a day that when you feel like, okay, at last I'm out of all this, this thing called eczema and all those things. And that one fine day that you feel like everything is okay, you are back in action, you're back to normal. What's the first thing you did?
Right. So this was something that happened. I still remember. I took a video of myself. If you remember the video that you just showed, there was a picture of me
Uh,
half naked. So that was the
yeah.
day I put a video stating that Alvin. I was talking to myself, Alvin. Uh, Please take note of this video of how you were, because this was how bad you were. Because I don't want to forget those days. I don't want to forget those eczema memories because it keeps me humble. It keeps me
Mm-hmm.
grounded. It keeps me passionate about my patients and not just taking this as a business. Not at all. This is just my
Mm-hmm.
service towards my patients. So the first thing, I thank God, because I tell you, I was praying like nobody's business. I was really praying, and I would see the 8 months change my life in the sense that so many great things. So I got to know God in a very, very intimate manner. I got to really understand who He was. And the first thing I told God is, the first thing I want to do is, I'm going to go out for dinner. So I told my mom and dad, let's go out for dinner. And I was fit actually. So I wish I could have the picture, but at that time, because I didn't shave, so I look
Mm-hmm.
like Veerappan a little
Devdas.
bit lah, not Devda, not to the extent lah.
Okay.
See, I'll
All
stay,
right.
I'll stay southern India, so I had the mustache and all that, and
Okay.
we went for my favorite. There's a Chinese restaurant in Nilai. My favorite place is called Lun Sing. So that's where I actually had my wedding actually. So
Oh.
we had our dinner there. So that was the first thing, and then the next one was dim sum with my wife and a movie. Those are the three first things that I can recall actually.
Okay, that's nice. So it's particularly a good time spent with your loved ones lah after so long.
Definitely, yes.
All right.
So,
That's a inspired story, I mean. Yes, Ranjini.
yeah, please go ahead. I'm just trying to
You're
get the
trying to do something there.
yes, but I couldn't. We still have time, so that's.
Okay.
But another one question to add on is, if you were to name a few people or whoever who were there in that particular phase, 8 months of that phase, you combating this eczema, who would that be? And if there's one thing that you would like to say to them through this program, what would it be, Doctor?
Yeah. So frankly, number one was God. He was there all the while, and he kept me going. My Lord Jesus, that he just kept me going and strengthening me every single day. So I have to give him credit, because he's the one. I believe that we doctors treat, but God heals. So that is,
Mm-hmm.
even till now, for all my patients, I pray for my patients, and I believe in divine healing.
Mm-hmm.
If talk about human factors, of course, the first was my wife, my current wife, my one and only wife. At least she's been a great support. The thing that she went through, I just think it's remarkable. And also my mom and dad, they were living with me for 8 months, and I still remember my father told me that my mom couldn't sleep, because when I wake up at 3 a.m., 5 a.m., I would actually bathe. I have to take a bath for me to relieve my itchiness. So I would bathe at 3 a.m. So my house, when we use the bathroom, the pump, we have a pump in the house, a main pump, so it gets activated. So the whole house can hear if anyone's bathing. So my mom couldn't sleep much. She was really, I think she was more stressed than I was actually. So, and friends wise, I mean, I had a lot of support. I wish I could name, because I don't want to offend anyone if I forget anyone.
Yeah,
But
it's
of course,
okay.
the closest person who was with me was, of course, Niven. Niven came to visit me once. Niven and his wife, Dr. Niven and Dr. Anila. I didn't want any visitors, so I stopped. And also my church members, a number of
Mm-hmm.
them who took their time to come and meet me. But I kept telling that I was not really open to meeting people. So if you're an eczema patient, and you don't have to force yourself to meet people, because if that stresses you up, tell your family members, and as friends, you know, the only thing you can do is don't try to over help at times. So I got this amazing thing. I just have to share this before you go to the next question. I got this thing that really cheered me up. So as everyone knows that I was very active in CDI. I was actually one of the top leaders in CDI, and they
Yeah.
a bunch of them, they actually wrote a big green colored card. I still have it with me. Get well
Uh-huh.
soon. You know, they gave tiny messages, tiny love messages and all that. On
Uh-huh.
probably a very big I'm not sure what you call it, but like something like a big A, not
It's a
A4. It's really
card.
huge. Yeah, it's a card, but really huge, and
It's a Manila card or what?
yeah, it looks something like a Manila card, as big as that.
Mm-hmm.
And
Mm-hmm.
the amazing part is it was not printed. Everyone was writing it from their heart. So that really encouraged me. So I want to take this opportunity. If any of you are seeing it, I truly want to thank you so much. It made a difference, so much a difference for me. Thank you so much.
That's very nice, and yes, to have such support in our life, because that what gives us so much of strength to go through our life whenever we are at our lowest low, because we need someone, I mean, some sort of strength like this. So I think you're really blessed on that part, Dr. Alvin. So shall we move on, Ranjini?
Yes. That was just a little bit off from our main topic, but it was a good sharing. Good to hear. Good to reminisce all those
Mm-hmm.
moments. And to add on to that question, this might be slightly off, but I really want to ask this: is eczema contagious?
Yeah, all right, it's a very good. Thank you for asking me. So, it looks contagious, but it's not. So, if you see an eczema
Mm-hmm.
patient, you can hug him. You're not going to get eczema because, as I said, all of us, if we are going to get eczema, I mean, a huge proportion of us have genetic inheritance. So, it's something that we have within. But hugging a eczema patient, kissing an eczema patient, you're not going to contract. It's not a contagious. It's not a communicable disease. So thank you for asking. It's a very good question.
Okay, and also for the viewers, if you have any question to Dr. Aylwin, you can type in the questions in the comment box, and we will direct it to Dr. Aylwin shortly. But another one, Doctor, I have a lot of questions also. Is eczema and psoriasis is the same?
Right.
Sorry.
So eczema and psoriasis is not the same, but it might
Mm-hmm.
appear the same. But there are a number of common denominators among those two conditions. Number one, it is chronic. So both psoriasis and eczema is chronic. It is
Mm-hmm.
an inflammatory skin disorder, both. However, we do notice different root causes for psoriasis and eczema. From my from my experience, I've seen that a number of them have actually this vitamin D deficiency, which is actually correlated with psoriasis. And
Mm-hmm.
just by applying vitamin D based creams, they have actually shown improvements. But you know what? I'm just talking one small aspect. So psoriasis is really huge, but it is almost it's a different skin disorder altogether. But the symptoms are almost the same. So you're talking about itchiness, bleeding, dry skin. That's the same. But psoriasis have other complications like joint issues and other systemic issues also. So that it differs to a certain extent, but not the same.
All right. That's a good clarification, because people might think it's same. Yes.
Fantastic. Yes, fantastic. Thanks for the explanation, Doctor. So we're moving on to the next questions. We have been live for the past 48 minutes.
Yes.
And we have one more questions, and of course, we're going to take up some of the questions from the viewers. So I'll go forward for the next question.
It's about
Okay, we
you
have
take
shared
or
the
I take?
page.
Yes.
Yes, I'll take.
Mm.
Sorry.
All right.
We have shared the Facebook page earlier
Yes.
on Eczema Doc. So, Doctor, perhaps you can share to us what is this Eczema Doc page all about, and what are you doing? What are the initiatives that you are carrying out through this page? Is it a campaign, or what is the objective of this Eczema Doc, Doctor?
Right. So actually, the first objective of why I actually published the page is to increase awareness about eczema. This is number one, because many of people don't even know what eczema is, because a lot of patients, they have job issues. for example, if you have a fracture, you can get a 3-week MC or 1-month MC, but eczema, you probably get a 1-day MC, which is really not enough. So I do hope if there are, employers here and one of your employee has eczema, please understand that it doesn't go off in a day. You just don't get an injection and, it disappears. It takes time. So they need time of rest, probably change of timing, because night shift is really bad. So one of the things is to increase awareness. Second is to provide the dream that I wanted, a doctor who could communicate with the patient online. Because I believe in online, the online platform. I've been a believer for many years. And I was thinking telemedicine is actually the best thing. And amazingly, just with this simple initiative on Facebook, I've got access to patients from all around Malaysia, and 90% of my patients have not met me. That means they have not touched me. They have only done online consultations. And guess what? Almost everyone is getting better. It's not a 100% deal, but almost everyone have a lot of testimonials. And the purpose of me putting his testimonials on the page is actually to just give encouragement to patients that, there is a chance for them to come out of it, and they don't have to go through it again and again. So these are the main reasons why the page has been there. And we hope that we can do more. And a small good news, I've not made this announcement as of yet. Probably I can do it on your talk show. For those who want to come and see me, good news, I'm going to actually launch my clinic in Nilai very shortly. I'm just doing all the paperwork. So by God's grace, if everything is going to go well, we should be opening up on December or January. And I would actually try to go more, because I have patients from out of Malaysia, and they would like to come and visit me. So I need a center. So I have a lot of ideas that me and my wife and my team members, we have actually spoken about this, and we plan to go global actually. So things are looking good, because a lot of people are struggling, but I think I'll stick to Malaysia because Malaysians need help first. So I give priority to Malaysians first.
That's awesome. Fantastic. Good news.
Yes.
And we are happy and proud that you're announcing this news in our platform. All the best. And Doctor, we would like to share, maybe we will take a tour on your page. Priya will do the sharing.
Yes, you want me to do? Because I am also accessing his page. Okay, I will add this to screen. Sure. I will add yours. That's it. Yeah.
So for the viewers, this is Eczema Docs page, and you can book appointment with Dr. Aylwin. And he also, because I also follow his page and I learned a lot about eczema. So this is his previous page. I think, Doctor, this is the page that you mentioned. I mean, for this, and sorry, I can. Okay, and also there are a lot of knowledge about types of food and updates about eczema that you can find out. I've been reading and gaining knowledge about eczema from his page. And I tell you, it's really comprehensive, and a lot of new things that I learned from this page as well. And as Doctor said, you can contact him directly and speak further about this eczema, and if you'd like to know more knowledge and gain more knowledge about eczema. Right.
I just want to ask Doctor, why you call them eczema sayangs? Because
so I still remember I had this I had one of my favorite medical officers when I was a houseman. He's actually one of my favorite ONG MOs. Now he's a specialist, and I just met him a week ago out of coincidence in Nilai. He's now in Sabah. He's if I'm not mistaken, he's an gynae oncologist actually. He's actually subspecialized. So I remember when he's so passionate about his patients, he used to call them sayang. So, and of course I can't use that to women because that will be sexual harassment under the Malaysian law.
Yeah.
So what I do is I call them eczema sayang. So that is pretty much general. Nobody can sue me, I hope. And of course, I treat all my patients like, especially those kids, like my children. Even when I address the mummy, I call what do you call mummy and their name, daddy and their name, because having the mother and father to be part of the process is really crucial. And also for
Yes.
adults, I do call them my eczema sayang. I can't call them by their name sayang. As I said, I can't do that. In my
Yeah.
ethics, I can't do that. But it's just to show them that I really, really, I'm in love with them, and in love in the sense that I just can't wait to see them become eczema free, go back to normal levels, and work. And one more point, before we end the talk show, there are also high amounts of divorce rates among eczema patients. That's because of, if you're okay for me to share this, the sexual intimacy between the husband and wife is actually disturbed because of the skin disorder, and because
Mm-hmm.
of that, there are marital issues. So that's why I'm telling you, eczema is really multifactorial. If you have another day, I can talk more about it, because eczema is something that it's so many things to talk about. I'm trying to compress as much as I can, within this short limited time. So
Mm-hmm.
even divorces have happened. So that's the reason why we should not take lightly of eczema, and we should really seek help for eczema. And I want my patients to know that it's not this is my passion. It's really my passion to help eczema patients. I do
Mm-hmm.
love other patients, but eczema is something so personal to me, because I have a patient's experience. So that's the reason why I call them eczema saying. Sorry for the lengthy answer, but yeah, I think that's about it. Yeah.
I mean, we can clearly understand that when you call them as eczema sayangs, we can see that how much of passion you have and how you are, eagerly waiting to see them eczema free. I mean, what could be a bigger gift than that? Because you have gone through the
And and
process
and
and
and also I do scold them. Some of them get a lot of scolding from me, because probably I love them too much. So some of them are a little scared of me, because when I'm in my doctor mode, I'm quite strict. I'm actually quite sure.
uh-huh.
I'm friendly, but if they don't follow the diet protocol, like someone here, they might get a long lecture actually from me. So yeah, it's
Who is
Okay. Who is that? I don't know.
someone.
okay, that's someone. Yeah. All right. Thanks.
All
End
right.
of discussion.
Yes. Doctor, perhaps I just want to ask something. Like, you mentioned about childrens just now, right? So, why do some children tend to get eczema? Because you said the root cause of eczema is different, and sometimes it's about to genetics, and sometimes it's about the processed food and our lifestyle and all those things. So, from your experience all this while, for children, what are the main cause or factor that causes them to get eczema?
Okay, let's say we talk about babies, for example. I mean, infants,
Mm-hmm.
those lesser
Mm-hmm.
than 1 year. And from my experience, I've seen a high prevalence of my patients. Uh,
Mm-hmm.
the babies, they have. I'm quite sure it's one of the major factors of genetic inheritance. And I also
Mm-hmm.
need to clarify that eczema is multifactorial, so it's not just one root cause. It's many root
Yes.
causes clumping together and manifesting as eczema. So for
Mm-hmm.
babies, what I've realized is most of them did not get breast milk. They did not get
Oh,
breastfeeding. So they go for formula
okay.
milk. So I'm a very big advocate for breastfeeding. A very big
Mm-hmm.
advocate for breastfeeding, because many mothers, especially mothers now, they try breastfeeding, and when it doesn't happen, they get stressed up. So, and they're busy with work, so they they
Mm-hmm.
they go for formula milk. But
Mm-hmm.
they don't realize that the breast milk has so much of amazing amazing beneficial properties to actually build up the immune system of the child. And in fact, it is loaded with good nutrients, amazing nutrients which can actually build up the immunity. So most of them, I've seen a high prevalence, and not everyone, but a
Mm-hmm.
high prevalence of them getting formula milk. So that is something that I would like mothers to realize. If you have problems in breastfeeding, don't have this conclusion that there's not enough milk. See, if you're stressed up, the brain releases a hormone which will stop the production of your milk. So that's why breastfeeding, husbands must
Mm-hmm.
play a role. To all husbands, if you're seeing this, if your wife is breastfeeding, make sure you give her a very comfortable environment. Breastfeeding is a very beautiful relationship between the mother and the child. It's amazingly beautiful. And there's a lot of emotional connection, hormonal released, all right? A lot of good hormones are released, happy, good feeling hormones. And not only that, when the mother is breastfeeding, one of my things that I tell my mothers, all my eczema mummies, is that, get a dim light, a relaxed environment, and get a jivang song, any song which is relaxed, don't put a.
Sorry.
Right, I think even the cyclist couldn't take it. So I'm talking about a jivang, a very relaxed, melodious, environment. They must be in a very relaxed moment, and they should not be multitasking. No phones. Put the phones aside. Breastfeed, because that is one of the biggest factors I've seen for babies in regards to your question, actually.
That's awesome. I mean, that's
Yeah.
another takeaway message for the viewers.
Another one, doctor. Okay, say if a person they don't have any genetic history of having the family don't have the history of eczema, and can a lifestyle, and they discover that they may have eczema at the age of like 30 plus and so on, can lifestyle, specifically like stress or any other factors apart from food, causes eczema?
So actually, in regards to that question, there is possibilities. There are possibilities. So there is a condition called leaky gut syndrome. This has been another very controversial topic among practitioners. Some say it's a myth. Some say it's real. Well, based on what I stand very neutral. I'm very pro patient. Whatever that helps the patient, and if it's there's a good fact, there's a proper biochemistry, a proper medical scientific explanation, I'm all open for it. I don't worry about controversy. If it works, why not? Let's help the patient. But I must know what's the science behind it. I don't want to just, if it works for this patient, I try it for another patient. So leaky gut, there is if for those, if there are doctors seeing this, this is a doctor that I truly respect, Associate Professor Dr. Peter Leo. He's from the Feinberg University School of Medicine. He's a pediatric dermatologist. And he has mentioned, he has done a number of small studies, and he has said that there are possibilities that leaky gut can actually exist. And leaky gut basically is one of the main reasons that some of us can get leaky gut. And if you're wondering, what is leaky gut? Well, just imagine your tube. The gut is a tube, and you have small holes in between. So food particles from the bowel, which are supposed to go out to your stool and so forth, it leaks out into the bloodstream. From your bowels, it's supposed to be a very sealed tube. It leaks out, and when it leaks out, it causes immune reactions, and that's where autoimmune reaction comes in. So immune hyperreactivity is one huge factor of eczema patients. So when patients take in a lot of things like processed food, which damages the lining of the bowel, and also stress. Stress can also cause stress ulcers, just for you to know. Emotional stress can also cause stress ulcers. So these are not just psychiatric things. I'm talking about reality. And do you know that 2/3 of our immune cells are in the deeper layers of our gut? So I used to think that it was all in the bone marrow. And now new research are actually, they're actually telling us that 2/3 of our immune cells are actually in the gut. So if you take care of your gut, hence you get better. So that's why when patients they finish, I always tell patients, don't take antibiotics without indication. Do a blood test. If your white cell counts are high, it's bacterial in nature, then yes, take antibiotics. But most of us, we want a quick fix. We see our our neighborhood doctor and say, hey doctor, give me some antibiotics, a quick fix. Unknowingly, they actually destroy the good gut bacteria. And when all the good gut bacteria is basically damaged, there's an imbalance in the gut microbiome. Hence, bad bacteria colonizes the gut, and it causes injury again to the intestine. So it's a lot of factors actually. And also another thing is that gluten is one of the main things that I tell my patients to avoid. I do take gluten once in a while, but those patients having severe eczema, I normally take it out. I have a replacement diet therapy. So gluten is one of the huge causative factors for things like leaky gut actually. So I hope this actually opens up some sort of thinking in this sense. But we are not conclusive about this. But my point here is, just because we are not conclusive in terms of this doesn't mean it doesn't exist. That means we need to discover. So I think that doctors should be more, instead of just doctors who read and just apply, they should be scientists. They must try to discover, explore possibilities for the benefit of patients. I think that is what I believe in, actually.
Awesome. Yeah, beautiful. And one more. Can we take one more question from us? Okay, one more. We still have time a bit. Okay.
Sure.
Is allergic reaction can lead to eczema? It's an
Brilliant.
innocent question.
So it's a very good question. So there are a lot of misunderstandings between allergies. For example, you're right, an allergy can trigger a flare-up in eczema. It can. For example, if let's say Ranjini, I take your bloods, and then you show hypersensitivity reaction. We have allergen tests that we can do, and then you show probably high IgE production. IgE is basically an antibody which is produced in response to allergic reactions. That's how our body reacts. So if there's a high IgE, E for England, high IgE level, example towards prawns, if you take a little prawns, your eyes swell up, you can get eczema flare up. So that's right.
Yeah.
But there's also another component which is called food intolerance. So this is what many of us have missed out. So number of my patients said, they've met some practitioners, and the practitioners have told them, hey, as long as you're not allergic, you can eat the food. Not entirely true from my point of view. Again, this is debatable, but from my clinical point of view, I don't agree 100%. For example, if let's say, have you heard of brinjal, katrika, for example?
Yes.
Now,
Katrika.
brinjal is basically a nightshade. It's a different group of vegetable which has high levels of histamine, very high levels of histamine. And Indians, we love brinjal. Without brinjal, what is an Indian
The round one,
curry?
right? Yeah, the round one, right?
Right. So of course we cut it into pieces, so I forget the original shape. But most of us, we see the internal part,
Like
right? Yeah.
eggplant, we have eggplant and also that.
Eggplant
Yeah.
is another one.
Yeah. So nightshades, basically you're talking about white potato, tomatoes, and these are all nightshades. So let's say you're not allergic, Ranjini. You're not allergic. So let's say, but you are prone for eczema. So I give you about probably 20 grams of brinjal today. You might not get any reaction, but the next day I give another 20, you might not get a reaction. But on the third day, when I give another 20, suddenly you get some sort of flare-ups. But you're not allergic to brinjal. So what it gives us that, what is the science behind it? It goes back to histamine intolerance, the first term that I mentioned. So brinjals have high levels of histamine, and the issue is that if our body system, we have a system called DAO, diamine oxidase, if that enzyme which is located in your bowel, so if you eat nonsensical food, your DO receptors are damaged, the histamine elimination, penyingkiran, histamine elimination system is not working. You're just loading yourself with histamine to brinjal, hence you get a trigger. So again, it's not just about allergy, but it goes back to food intolerance with the basic understanding of histamine intolerance. So if patients can understand that, then they'll understand that, then I need to be careful on my food. But did I say that they cannot take brinjal? For example, we just celebrated my wife's birthday in a Thai restaurant in KL, and we had an amazing time. We had really good food, and my wife wanted to order brinjal. I said, "Oh, Aylwin, you can't take brinjal, right?" So I told her that no, it's okay. I took it and no issues. But if I continuously take it, my body cannot regulate the histamine which is coming in too much. So I need to give time, so I space it out. So there are also a group of doctors who go extreme about diet, eliminate everything. I don't work there. I need to understand how it works and work according to that, based on medical science for the patient's benefit.
Wow. Okay.
That's
That's
nice.
that's good news. Good information, and actually, like I learned about brinjal today. Okay.
Yes, Ranjini,
I mean,
yes.
If it's very useful for you, Ranjini, I guess.
In my curry and in sambar and okay.
Oh yeah, but
And
regards to that,
Yeah,
if you want to put it in your curry, like white potato is some tomatoes, katrika, all these things that we add on. So what I tell my patients is you don't have to take it out, but don't consume it. You don't have to consume it. You don't have to eat it. But you can use the curry, but you don't have to consume it. That's what I suggest.
okay. So fantastic sharing, Doctor. I mean, an hour and 10 minutes. it's like so much of knowledge in from one person. You're like, you just have everything stored in you, and it's just a matter of time it shoot to you, and it's like coming out like shoot, shoot, shoot. Wow, that's fantastic. And more, if you would like to
And
know,
certainly it becomes like a, food science or food nutritionist section, something like that.
yeah, I'm reading down. But those are, I mean, of course, all those knowledge and sharing about it, especially is very detailed on that specific food and what are the things is really true. And some really, I mean, yeah, I mean, based on experience, I have experienced some, and yes, it's I really do feel a difference when I eliminate certain part of certain food. So that's we're gonna attend questions, Priya. So maybe.
Yes, yes. I don't know why, but some of our viewers have written this வீட்டுக்கு பின்னால. I don't know what it means, but I'm sure there is some hide meanings. And yes, even Mr. Daniel also,
What is
later
it?
you can go through that. I don't know. He don't want to say because I've already asked him before.
Is this still gonna remain as a secret, or you're gonna reveal it? Sure.
I think I've revealed too much of secrets today, so the secret deal is off. We have locked all the doors.
Okay,
Guys,
that's
if
okay.
you would like to know what is this வீட்டுக்கு பின்னால, you can inbox Dr. Aylwin directly. Yeah.
Yes.
Let's take
Not only one. Yes, let's take the question, by the way. So, Dr. Alvin, what particular food to consume and not to consume? So,
Alright,
this
so
one, I
good.
think it's
Okay.
Yeah, so it's a good
related to
question from
eczema.
Dr. Sanjay. So generally, I just put this into groups. Number one is that I try to get my patients to avoid these four groups of food. Number one, gluten. So gluten, anything which is made out of refined white flour like tepung gandum is something that I avoid. So I've not taken bread for a long time. So that means white bread, your gardenia bread and all those breads, even oatmeal, because this is wheat. And the basic particle of wheat is proline, which actually causes long-term issues with the gut. So I take almond bread. So I do my own almond bread with almond flour. It's very simple. So if I can do it, I'm quite sure everyone can. Second group is dairy products. So I try to avoid milk, cheese, yogurt as much as I can. As I said, I have my angel days and my non-angelic days. Angel days means I follow my diet. My non-angelic days are the cheat days. So the cheat days I do take teh tarik and all that, but as much as I can, I avoid it. Third group will be processed food like deli meat, sausage, burgers, chicken nuggets. These are all processed food. And lastly, sugar. Just for you to know and for everyone to know, white sugar doesn't exist in my house. There's no white sugar. And I pity my mom, my dad, my wife. They're all obliged that no white sugar is allowed. We don't consume white sugar, but there is other options like stevia drops. So stevia drops is an example. Stevia leaf, they have this powdered form. So these things that you can add on. And there are certain things also other than that, like coffee, for example. Actually, coffee is good. If you're going to black coffee, 100% black coffee that you brew yourself, now that is good. But majority of us like coffee because of the milk and the sugar, which is actually a bad thing. So if you take pure black coffee in the morning, actually it's quite okay. Generally, other things that I also suggest would be what do you call rooibos tea. It's a specialty from South Africa. It's called, I probably just spell it out for you. ROOIBOS, rooibos. Rooibos tea. It's a very good potent flavonoid. It's a very good anti-inflammatory tea, which helps in reducing the inflammation. So I hope that answered the question.
Okay.
Fantastic. And we have one more question from Deva Lechini.
Yes. All right. There you go. So Ranjini?
So this question is from Deva Lechmi. So the question is, hi doctor, how long does eczema last, and can eczema be lifelong?
Hi Deva, thank you for posing your question, Deva Lechmi. Number one is that eczema is lifelong. So even I have eczema right now, but the reality is that as far as we know, up to now, unfortunately, we don't have a cure. However, you can be eczema free. meaning you don't have to live with the symptoms of eczema. It's something like cough and cold, and I don't want you to be discouraged with this statement. Cough and cold is actually not curable because it comes back. Do you realize? So we take certain tablets and all that, because viruses can come and come and come. You cannot stop, right? So what we can do is to build up our immunity so that we are not prone for it. So eczema, even though it's lifelong, it's not curable, but you can be eczema free, which is almost as synonymous with free of symptoms, which is cured. But I cannot use that word because that's wrong. So patients can be eczema free.
So I heard this term as seasonal eczema.
Seasonal eczema normally occurs for those with 4 seasons, especially during winter, because the skin becomes super dry. So the mistake most of them do is they put wet wraps. The issue is one of the main root causes for eczema is bacteria. And now there's a theory that eczema could also be an infection, not contagious, but it can be an infection itself. This is not a secondary infection. So when you put wet wraps, you don't put about wet towels on the affected limbs. Bacteria loves moisture environment, so be swimming and it'll trigger eczema flare up.
All right, so I hope that answers Dr. Devalashmi. I mean, she's a doctor, by the way. Her answer.
Okay.
It's another one question, a good question from Dr. Punithan.
Yes.
I think we'll have a finale question, but we will attend this first.
All right, so this is from Dr. Punithan, your best buddy. Any recommendation on soap, moisturizer for eczema? Maybe you can recommend. Yeah.
So there are actually hundreds and thousands of products that you can find in your pharmacy shelf. So, but let me give you a very practical answer to that, because many of them they can buy certain brands, and I don't want to mention these brands because I'm not tied to them due to ethical reasons. But I just talked about on a general thing. Soaps are very expensive because it's a daily use. So when patients go on this, they call them gentle wash, all these things. It doesn't really change the eczema per se until and unless we treat the eczema from within. It's not going to change. But of course, like for my patients, I'm going to tell you a very crazy thing which I tell my patients. I'm a very practical doctor, so I also bring in finance as part of my treatment. That means I need to see the practicality of that. I don't want to just bombard them with expensive things. So if you go to Speed Mart, okay, there is a I'm not going to mention the brand, but you can check it out. It's called Goat's Milk Shower Cream. It's just about $7-8, and it works wonders for my eczema patients, because some of them spend about $40-50 just for a small shower cream bottle, which is apparently eczema friendly. But this Goat's Milk Shower Cream has been amazing for my patients. But one thing I have to tell patients is when you take baths, quick baths, 10 minutes, try to get cold to warm, no hot baths, because it dries up the skin even better, even worse, I'm sorry. And adding to that, the soaps must be applied to the tempat pelipat. That means you're talking about your armpit, your private areas, but the other areas, minimal amount of soap is enough. You don't have to put much of soap actually, because soap dehydrates. Whatever soap you use, it dehydrates. So I hope that answers the question. And Punithan, I'm not sure whether he uses much of soap every day, but we'll see how it goes.
Oops.
Okay.
So bad, you guys laughing at Dr. Punithan, so bad.
All right, so that's from Dr. Punithan. You see, I mean,
Priya, I think we're gonna yes. We're not gonna have another session, Dr. Punithan. Maybe we can have it now, Dr. Aylwin. The viewers really, created this what you call curiosity in us to know what exactly the Veetukku Pinnale means. What is it?
I don't know about the viewers, but I am very curious about this.
Look at that. Even my father has commented.
Yes.
So please say something, doctor. We can't sleep
Please
tonight.
break the silence, please.
Probably this. Let's put this as a pre-launch for part 2 of our interview. So we can, let's make it expensive. Increase your viewership. Have a good pre-launch. Increase the duration. Have a 90-day plan, and we can get a better response for that.
it's like,
we can look for a timeout with Eczema Doctor Season 2 hashtag வீட்டுக்கு பின்னால the real meaning
I
revealed.
guess that's
Yes.
going to be the title. So I guess not only us, but also some of the viewers, most likely, they can't sleep
Yep.
tonight thinking about this.
Yes.
வீட்டுக்கு பின்னால story. I shall Google it. But okay, there's one question from Dr. Punithan on sharing your page and also contact number. So yes, Dr. Aylwin's page is Eczema Doc as shared earlier. And would you like? I think the best way to contact Dr. Aylwin will be through the page itself and through inbox.
So patients can inbox me, and then my admin will basically guide them through what to do next. So they just have to inbox me, and then we'll guide them what to do next. And if we can do a online video call, so we'll make an appointment basis. Then from there we'll see how. And amazing thing is that telemedicine has really helped a lot of patients. Lastly, probably the last thing I would like to tell is that a lot of I think ever since MCO, people have been very open towards telemedicine. And in terms of eczema, telemedicine is very practical. Because for eczema patients, I don't auscultate, I don't check the blood pressure. I see that is what you call a visual diagnosis, meaning we see the pictures are good enough. As long as the pictures are taken well, I can see it because based on my experience. And just by looking that, many of my patients have got better. And I'm talking about patients. I have one patient is a specialist in Sabah, and he was on immunosuppressants for 1 year. And despite immunosuppressants, because that's the last stage for eczema treatment in the hospital setting, he was having flare-ups, and now he's eczema free. We have off these immunosuppressants, and he's doing amazingly well. So, and all through online consultation. I've not even met him, so I need to thank God for online. I have to give a big shout out to online consultation. It's made a lot of difference for both me and my patients actually.
Yeah. And it's in fact a very new experience, and especially it's very interesting also to hear that you diagnose your patient and you give advice and what to do next and so on, and and at the end of the day, and they achieve what they want. And also from your side, you are happy, and I always see you sharing the good news in your page. So that's fantastic and really nice to hear, and look at how technology has made our life better. Yeah,
True.
Yep.
I agree to the statement. So that was a fantastic session with you, Dr. Aylwin. I mean, we feel like this is like very casual, fun, filled with a lot of inspirational stories. I mean, more to say story, it's a real life that you went through, and now you are inspiring a lot of people out there, and it's kind of giving hope to people who thinks that there is no hope left. I mean, that's awesome. What are you doing? Because people, you can check out the comment box later. So much of appreciation. People are saying that you're awesome. You're doing a great job. I mean, unfortunately, that's what we all want, and I think that's what you hope. I mean, after you recovered, I mean, eczema free, and achievement that you have made, and this is, I think, the moment you feel like your purpose of life, your calling is in here to give a better life to all the eczema patients out there. So what you're doing is fantastic, Doctor. And Ranjini, if you have anything to say.
Yes, it's fantastic, and a very superb session today. Again, an hour and 20 minutes or so, and it's fantastic sharing,
Yes.
fantastic knowledge sharing, and so many things. And we're going to leave end this show with the suspense of for you guys and also for
வீட்டுக்கு
us.
பின்னால.
வீட்டுக்கு பின்னாலே. So we may have a future session with you, Doctor. Until then, thank you so much for your time today, and yes, and we will get in touch with you shortly, Doctor.
I just want to say something to all so to all I just want to say one thing for all eczema patients.
Sure.
To all eczema patients, if you're seeing this, if you're really struggling, I want to truly encourage you, don't give up. I know how you feel. I've been there. I've come to a stage where no medications were working and so forth. So if you really need help, feel free to inbox me. There are also other medical practitioners who are also as passionate as I am. It's not just me. But if you really need help, feel free to inbox me. I want to help you and we'll journey this together. So don't give up. There is hope. God bless you and never give up. Eczema Sayang. And I love you all.
All right. Thank you so much,
Yay.
Doctor.
That's
Thank
a
you
wrap.
so much.
Yes.
All right.
Thank you.
So thank you so much, Doctor. We see you soon in another fantastic episode, if possible. Hashtag Viti Kapinala. Take care. Bye bye. Good night.
Bye.
Bye.
Bye, Doctor.
Bye, Doctor.
All right.
All
So
right.
that was a fantastic session, Priya. Again and
Yes.
again, 12 episode. It went bang on for of course us, and we really hope that it would have gave new information for those who don't know what is eczema, and also for those who have been seeking for to know more about this eczema. I'm sure this session is definitely would have been a good session. And of course, if you'd like to know more about this eczema, do contact Dr. Aylwin through his page Eczema Doc, and he's very very fast in responding as well. So
Yeah.
get in touch with him personally also to know more about eczema and also to get his consultation. So until then, signing off, I'm Ranjini.
And I'm Devapriya. See you guys in a fantastic episode next week. Bye bye.
Yep.
Good night.
Bye. Oh yeah, hashtag Vidika Pinale.
Don't forget that.